Hi, my name is Jamie Forster. I'm a family therapist and specialist fertility counselor. I work for my own private practice called Counselling and also provide the counseling services for a few clinics here in the Northwest. I thought I would take a moment to make this quick video to discuss the HFEA's treatment reinstatement process that begins today and have a quick look at what that actually means for you as patients. On the 27th of March this year, the HFEA suspended fertility treatment in the UK. This was an extraordinary measure that was necessary for protecting the patients and clinic staff at the beginning of the COVID-19 quarantine. This meant that all new treatment, which included IVF, IUI, frozen transfers, surgical sperm retrievals, and ovulation inductions, were all stopped. All of the patients I was seeing during this time and since have been primarily focused on two things. Number one, being how is this break in treatment going to set back their dreams of becoming parents? This is particularly difficult for patients with low ovarian reserve or poor egg quality, whose treatment is highly time sensitive. Number two, and these came up in every single one of my sessions, were the feelings of frustration, anxiety, and fear that resulted from not knowing when the HFEA would be able to reinstate treatment, meaning that there was no end goal to work towards. So for the past several weeks, with all of my patients, we have been working on implementing strategies for day-to-day emotional management. So I guess here we are. We're on the 11th of May, and the HFEA is allowing clinics to apply, by way of self-assessment, to reinstate treatment. So let's just have a quick look at exactly what the HFEA means by that. And this is an excerpt that I've taken directly from their website. The safety of patients and clinic staff remains our priority. Before a clinic can resume treatment, they must demonstrate that they can provide a safe service for patients and a safe working environment for clinic staff that complies with the recommendations from professional guidance. Clinics must have a COVID-19 treatment commencement strategy in place before they can restart treatment. And this is really important. Not all clinics will be able to resume treatment at the same time. Now, this is a fantastic step in getting treatment moving again. However, I know certainly many of my patients were very worried about when the end would come. And I can imagine that this particular date is going to be very significant in the minds of so many patients just like them. However, and the truth is, this is just the beginning. The clinics have to submit applications, and then the HFEA has to go through each and every one of them with a fine-tooth comb. And this is approximately 119 licensed clinics across the UK. The clinics have to gather, prepare, and train their staff, ensure sufficient stocks of PPE, and write all of the policies necessary to show the HFEA that they have done everything necessary to ensure the safety of patients and staff. So the main question is, how does this affect you, a fertility patient who is waiting to resume treatment? And unfortunately, all I can say is that there's still going to be a wait. And the best thing you can do during this time is try to remain patient. Continue to try to build yourself up so that when your number is called, you will be treatment ready. I always tell my clients this one phrase. And the phrase is, depressed people live in the past, anxious people live in the future, but the happiest people I know live in the present. The best way that you can support yourself is to be present, stay grounded, work on cultivating a positive mindset and a sense of gratitude for all of the good things that are already present in your life. Because life doesn't begin with a positive pregnancy test or even the birth of a child. The only life that is promised is the one that you are already living, even here in lockdown. And I know that this might be really hard to understand, but even right now, life can be beautiful. And the best gift that you can give yourself during this difficult time is the gift of looking for calmness and simplicity in it all. And by simplicity, I mean looking for these things in the room that you're in, with the limited circle of people that you're in contact with. You can find peace in this place. And the more you focus on that, the easier this wait is going to be. So I beg you, please be patient and know that we are working night and day to get things ready for you. We deeply care about you, and your dream of a positive fertility outcome is our dream as well. We are working so hard to make things safe for you so that you can get started with your treatment without the added worry of, am I going to contract this terrible virus in this process? We always have and always will continue to work so hard for you. So be patient, stay calm, and continue to prepare your mind and body for your imminent treatment that will come. Utilize the support that is available to you, either through your clinic counselor or by finding a counselor through the BICA website. If you'd like to access support with me through Akiso Counselling, or if you have any questions about anything that I've said in this video, or even if you need help finding a counselor near you, then please get in contact, because I'm here to help you. So thank you so much for listening, and I sincerely wish you the very best for the coming weeks and pray that you can get back to your clinic as soon as possible. So thank you so much and have a great week.